My name is Therese Kenny and I'm currently a student at Memorial University. I saw an occupational therapist when I was being discharged from the hospital. I was admitted for an eating disorder and anxiety, and so we worked together and coming out of the hospital and transitioning back into outpatient. My work with an occupational therapist helped with mostly organizational, planning my life, and that started a lot around food, like how I was going to be able to live my life but still follow my meal plan, and how I could not study for 12 hours a day and still feel okay with how I was doing in school.
My name is Weldon Bunnell. I'm a child and adolescent psychiatrist. When patients and patients' families ask me, they kind of give me a funny look. You know, I'm here with my child because they have ADHD or because they have depression. Why are you referring me to an occupational therapist? What is this person going to do for us? It's like psychotherapy for your body. Recognizing that there's this connection between your mind and body, and it goes both ways, and we can work on things in your mind, and that can improve things in your body, but it goes the other way around too. We can work on things in your body and it can help things function upstairs.
I'm Hazel Russell. I'm a clinical social worker with outpatient psychiatry. OT's focus, I think it's a broader focus in the sense that it's outside of the parameters of an office. So they're stepping outside of that and actually completing work with clients in their own homes. So they get a different feel for what's happening. They're hands-on. Really a lot of focus on grounding, which is something that's really helpful right across any of the work that we complete.
All of the members on my team were really important, but I worked especially close with an occupational therapist, especially where school was such a big part of my life, and I had a lot of anxiety going back to school and wasn't really sure how to handle it. Like, we worked a lot on that, and it's really been a big factor and motivator for me to continue with recovery and not kind of give up or relapse when it gets hard, is because I love school and I love working in the lab and I love doing those things, and I wouldn't have been able to do it without an occupational therapist.
It comes down to this idea of just improving their overall level of functioning, decreasing their burden of illness. We're going to work on the things that we can work on, whether that's riding a bike or improving their handwriting or anything under the sun, and that might help lessen the overall burden of things they struggle with on a day-to-day basis.
There are good days and bad days, like with everything, but I'm a lot better at managing the bad days now, and my life is less revolving around food, and food just fits into my life, so it's kind of reversed itself from where I was a year ago, which is pretty awesome.
That's what an OT does.
That's what an OT does.
That's what an OT does.
Newfoundland and Labrador Association of Occupational Therapists. For more information, visit NLAOT.ca.